Linking on my brain. Okay. Linking on my brain. I got linking on my brain. Whoa.
Chapter 161. Epilepsy. Introduction. Epilepsy. Epilepsy is a brain disorder characterized by convulsive seizures or loss of consciousness or both. Convulsion and convulsive seizure. Convulsion refers to uncontrolled involuntary muscular contractions. Convulsive seizure means sudden attack of uncontrolled involuntary muscular contractions. It occurs due to paroxysmal, sudden and usually recurring periodically, uncontrolled discharge of impulses from neurons of brain, particularly cerebral cortex. Epileptic. Patient affected by epilepsy is called epileptic. The person with epilepsy remains normal in between seizures. Epileptic attack develops only when excitability of the neuron is increased, causing excessive neuronal discharge. Types of epilepsy. Epilepsy is divided into two categories: generalized epilepsy, localized epilepsy. Generalized epilepsy. Generalized epilepsy is the type of epilepsy that occurs due to excessive discharge of impulses from all parts of the brain. It is also called general onset seizure or general onset epilepsy. Generalized epilepsy is subdivided into three types: grand mal, petit mal, psychomotor epilepsy. Grand mal. Grand mal is characterized by sudden loss of consciousness, followed by convulsion. Just before the onset of convulsions, the person feels the warning sensation in the form of some hallucination. It is called epileptic aura. Convulsions occur in two stages: tonic stage, clonic stage. Tonic stage. Initially, seizure is characterized by tonic contractions of muscle leading to spasm. Spasm causes twisting facial features, flexion of arm and extension of lower limbs. Clonic stage. Clonic convulsions develop after the tonic stage. This stage is characterized by violent jerky movements of limbs and face due to alternate severe contraction and relaxation of muscles. At the end of attack, alternative tonic and clonic convulsions are seen. During the entire period of seizure, tongue may be bitten. Electroencephalogram, EEG, shows fast waves with a frequency of 15 to 30 per second during tonic stage. Slow and large waves appear during clonic phase. After the attack, slow waves are recorded for some time. In between seizures, EEG shows delta waves in all types of epileptics. Causes of grand mal. Cause of grand mal epilepsy is the excess neural activity in all parts of brain. Cause for stoppage of attack is neuronal fatigue. Factors which accelerate the neural activity resulting in grand mal epilepsy are strong emotional stimuli, hyperventilation and alkalosis, effects of some drugs, uncontrolled high fever, loud noises or bright light, traumatic lesions in any part of brain. Petit mal. In this type of epilepsy, the person becomes unconscious suddenly without any warning. The unconsciousness lasts for a very short period of 3 to 30 seconds. Convulsions do not occur. However, the muscles of face show twitch-like contractions and there is blinking of eyes. Afterwards, the person recovers automatically and becomes normal. Frequency of attack may be once in many months or many attacks may appear in rapid series. It usually occurs in late childhood and disappears completely at the age of 30 or above. EEG recording shows slow and large waves during the attack. Each wave is followed by a sharp spike. This type of waves appear from recording over any part of the cerebral cortex, indicating the involvement of whole brain. Delta waves appear in between the seizures. Causes of petit mal. Cause of petit mal is not known. It occurs in conditions like head injury, stroke, brain tumor, and brain infection. Psychomotor epilepsy. Psychomotor epilepsy is characterized by emotional outbursts such as abnormal rage, sudden anxiety, fear, or discomfort. There is amnesia or a confused mental state for some period. Some persons have the tendency to attack others bodily or rub their own face vigorously. In most cases, the persons are not aware of their activities. Some persons are very well aware of the actions, but still the abnormal actions cannot be controlled. EEG recordings show low-frequency rectangular waves, ranging between 2 and 4 per second. Causes of psychomotor epilepsy. Causes of psychomotor epilepsy are the abnormalities in temporal lobe and tumor in hypothalamus and other regions of limbic system like amygdala and hippocampus. Localized epilepsy. Epilepsy that occurs because of excessive discharge of impulses from one part of brain is called localized epilepsy. It is otherwise known as local or focal epilepsy or local seizure. It involves only a localized area of cerebral cortex or the deeper parts of cerebellum, which are affected by tumor, abscess or vascular defects. The abnormality starts from a particular area and spreads to adjacent areas, developing slow-spreading muscular contractions. Contractions usually start in the mouth region and spread down towards the legs. This type of seizure is also known as Jacksonian epilepsy. Causes of localized epilepsy. Localized epilepsy is caused by brain tumor.